Hello, everybody. Hey, my name is Mike Cola, and I've been a fitness trainer and gym owner for over 25 years. And in this live video, we're going to be talking about stem cell injections, primarily for your knee. Actually, if you've been following my YouTube channel, by the way, I put out videos like this every single week. So if you're looking to turbocharge your fitness, health, or nutrition, make sure you hit that subscribe button. I try to really put out all that content every single week. Okay, let's talk about these stem cell injections. Actually, if you've been following me a little bit on YouTube, you know that I've been dealing with the knee issue for a really long time. I own a gym. I've been a fitness trainer, so I'm really active. And even though I've had this knee issue, I'm still able to maintain a pretty low body fat percentage. I stay around 10% body fat all year round, and I stay pretty fit. And I've been working around this knee issue. I'm trying a number of different things over the years. Unfortunately, I had a knee operation about 10 years ago. First, I tore my MCL, my medial collateral ligament. And then about 6 months later, I tore my meniscus, running. And then about a year after that, I had a meniscus operation. And unfortunately, I didn't have too good of a result. My knee never felt good ever since then. And, I've had good and bad days over the last 10 years. And it's getting to a point now, after trying a number of different things. I tried those chicken comb gel injections. I have a little bit of arthritis in the knee. I still got that piece of meniscus missing. And I just tried a cortisone injection, and now I think I'm going to go in the direction of stem cells. So I'm seeing a doctor tomorrow who specializes in stem cell injections and PRP, Platelet Rich Plasma injections. Okay, now I know that the stem cell stuff is getting popular. Actually, a friend of mine had them done 2 years ago. Tremendous results. Similar situation to me. Had a meniscus operation. He kept on swelling up. He had these stem cells, and actually it worked really well for him. So going to see his doctor. It gets a little confusing in exactly the type of stem cells you're supposed to get injected with. For example, I just listened to Joe Rogan's podcast. Love his podcast. He's had a number of different stem cell injections. He had placenta tissue stem cells. That's actually from a donor, obviously injected, I think, into his knee. And then I think he even had bone marrow, I think, on another podcast of his, I think, into his shoulder. And he's had great results with both of them. So the doctor I'm seeing tomorrow, there's 3 different types of stem cell injection. One he does is the subcutaneous body fat. They take it, it's almost like getting liposuction. They take the body fat out, they spin it in a centrifuge, collect the stem cells, injected in the injured joint. That's one thing. That's one way of doing it. The other way is you can do bone marrow. For example, they put you onto a fluoroscope. That's like an X-ray machine. They obviously they numb the area. They put a needle in your ilium on the top of your pelvis. They suck out some bone marrow. They spin it in a centrifuge, collect the stem cells, inject it back into the injured joint. And the third way is umbilical cord. They get it from the umbilical cord. I know there's a little controversy on that. And I have to say, I'm not an expert on that, but I'm going to do a lot of research. I'm really looking forward to see what this doctor has to say tomorrow. And I know he cocktails these injections with PRP, which stands for Platelet Rich Plasma injections. These have been popular. These have been around for years. This is more of a mainstream type protocol. It works great for tendonitis. I've had a number of my clients with tennis elbow and like shoulder tendonitis get PRP injections, and it really does work. And it's that whole same concept where they take blood. They just just take a little bit of blood out of you, a few vials of blood. They spin it in a centrifuge, collect the platelets, and inject them back into the body. And they're kind of like growth factors. They're kind of like healing agents. Just that whole concept now. Like, for example, if you sprain something, if you injure yourself, you can take an anti-inflammatory to make you temporarily feel better, but new research is showing that it generally slows down the healing process. Like, you really want that inflammation. Your body's supposed to for a reason. You want the platelets there. You want the white blood cells. So by getting these PRP injections, it actually speeds the healing process. Some people think it also breaks the pain signal. I saw a doctor a few weeks ago who recommended I try PRP injections, but he was a surgeon. And he generally gives them after surgery. Surgery still might be an option for me in my knee. I've had a number of different opinions, and I'm just trying to work the whole thing out. I just figured I'd do this live broadcast. See if anyone's out there, anyone who's watching this has had these injections. If you had, just drop me a comment. We can talk about it. I'm curious to know how well you've done with them. And I'll do a follow-up video. I'm going to be seeing them. Looking forward to it. I'm seeing this doctor tomorrow in the afternoon. And what, obviously everything he tells me I'm going to take note, and then I'm really going to do a lot of research. I know there are certain things that there are certain types of stem cells. For example, you're not legally allowed to grow stem cells in the U.S. And I listened to another one of Joe Rogan's great podcast with Mel Gibson. Mel Gibson talked about his dad, who was like 92 years old, horrible hip pain, hip arthritis, torn labrum in the hip. He was in a wheelchair for a while. They went to a clinic and a doctor in Panama who actually, I think this doctor in Panama grows the stem cells. We're able to, so you get a really concentrated injection of these stem cells. He had them in his hips. And then I even think they give you an IV injection. These stem cells, they pretty much go wherever the problem is, and they kind of like fix it. It's the future of medicine is, in my opinion, is going to really center around these stem cells. Obviously there has to be a lot of studies still to be done, and clinical type studies. I'm going to link up a few, in the comments, not in the comment section, in the description section of this video. I did a decent amount of research already. I'll put some link to some articles from the Mayo Clinic, from the Harvard, medicine letter, which is actually, I'm not sure if it was the Harvard School of Medicine, just did a study on it. I'll link that up in the description as well too. And even Mel Gibson was talking about, he had injections in both shoulders. He had arthritis, torn labrums in both shoulder. Just labrums is basically just the ring of cartilage that runs around your shoulder, runs around your hips, like that. So I mean, these injections are supposed to really potentially grow back cartilage. They have growth factors. They speed the healing process. They pretty much create an environment for healing. And I've heard incredible things about them, so I'm really excited about this. And I'll let everyone know. I'll get back to you. I'll do another live video later in the week. I'm going to see the doctor. I want to do a lot more research, and then I'll do another live video. And hopefully I'll try to market this live video. So I want to get a lot of people talking about it, participating. And that's pretty much it. Well, I hope everyone's having a wonderful day. And don't forget, if you're looking to turbocharge your fitness, health, and nutrition, hit that subscribe button. I put out videos like this all the time. All right, take care, everyone. Have a wonderful day.